Albert. How's it going?
I don't want to be here.
I know.
How does it feel to work at a spot where most people are nervous about coming to?
I'm used to
Well,
it.
first of all, is that true? Are most people, especially when they first start coming?
Not really. Not as much as I've seen in other offices. So I've
Got
worked
it.
in other offices and they have more of that. But for the most part, people that come here, they kind of know what to expect.
Because you've built a culture around it.
Yes.
But the initial reaction when it comes to someone digging around in your mouth with metal tools is
Nobody
not like
likes
this.
it.
Nobody likes
Nobody
it.
likes it.
But it's necessary. So how do you make people comfortable with the process?
Well, I usually get to know them first
Yeah.
and see where they're coming from, any history of trauma, get to know them basically.
And do you discover that historically people have just had bad experiences with the dentist?
Yes.
Yeah.
It's usually a bad experience with the dentist.
And what's a bad experience with the dentist?
One time I had a patient that actually said their orthodontist scared them. So I said, what do you mean by that? And she goes, I feel like every time I go there, all he wants to do is give me pain. Yes. So
Wow.
that kind of stuff. Or they would just be mean altogether, just really not gentle.
Yeah.
So that would be one of those.
All right. You're making me feel better already. And,
Okay, good.
And I know you are a woman of faith, so we got the
Well,
same.
Albert,
we
I
got
always
Jesus
tell-
on our side. So.
I always tell my patients one of the reasons people feel very scared at the dentist is because they feel like they don't have control. And when we do your exam in a dentist's office, most people think it's just taking a look at the teeth. But from the moment you sit here and I start talking to you, I do a full assessment, the way you speak, the way you smile, the sound that comes out of your mouth. And then we look at your mouth, the teeth. I correlate the x-rays with your teeth for cavities. We check and see if you have bone loss, and you can only see that in the x-rays.
And
Yes,
you're really
your lips.
examining me before I even sit down, before I even realize you're examining me.
Yes.
Tell me why look at an x-ray and not just look at my mouth, because you're looking at my mouth. What does the x-ray show you that you can't see here?
So the x-ray shows me things that are hidden. And so with the x-ray, it shows you the amount of bone loss that you may potentially have. And with bone loss, essentially you can have a perfectly healthy tooth, but no foundation. So we don't ignore the foundation of your teeth, which is your gums. We also have to treat that.
So in the x-ray, you're not just looking at the teeth, because you can have great teeth, but poor foundation and have a serious problem.
Yes.
Oh, that'll preach. That'll preach. Tell me about the conversation then that you have to have with the patient about what you've seen.
So generally, after I do my exam and diagnosis, I do ask them, would it be okay for me to show you the pictures of your mouth? And most people would say yes, because they do want to know what's wrong with their mouth and how we can fix it and get them to be healthy. But there is a small percentage of people who refuse to see it, and it's because they do not want to know how bad it is for the most part.
Wow.
Yeah.
So you can have something bad going on in your own mouth, but refuse to look at it because you don't want to know the truth of what's happening in your own body.
Yes.
Wow.
The next step is we usually put in a treatment plan.
Treatment plan.
And when we do the treatment plan, we put in the most urgent
Yeah.
to the least urgent. But we try to make sure that it's the complete treatment plan that's presented to show you to get to a healthy state, this is where you're going to be.
So what you may see, there's a temptation that it may be overwhelming to see all of that at one time. But trust the process, trust the assessment of the doctor, and you put together a plan and a process for healing that won't come overnight, but it will come over time.
Yes, and I always tell them, even let's say you come here and you're not in a lot of pain, and you have all these undiagnosed cavities that are there, that are present, and we start working on you, you will go through a process where things can be sensitive for a while, while your body heals before everything feels better.
Yeah. So there, once you're doing, once you're doing the work, there's a season of sensitivity.
Yes.
In the area where the work is being done.
Yes, and you have to be patient to allow your body to heal.
To allow the body to heal, and in the meantime, trust the process. Over time, it will get better. It will heal. That's pretty beautiful.
If you take care of your teeth.
If you take care of your teeth. But that's the thing, you got to be intentional.
Yes.
And you got to follow the instructions, which, you know, I don't always do all the time. But the doctor is gracious and patient, and I got a box of dentures just in case things go really bad. No, I think that's good. And then I think that the other part that we just got to be honest about is the process costs something. And to think that you're going to go through this journey of healing and health and it's not going to cost us anything is unrealistic. Because there are people, I would imagine, that see all the work that needs to be done, but then they see the cost and they never get the work done because of the cost. All right. Dr. Q, you're amazing. Thank you so much for talking through what you do every day.
Thank you.
And you're right. I'm not as scared to come. I feel a little bit more relaxed. So yeah, I'm glad I came.
Because I think you have so many people here that's ready to hold your hand.
Right. Please hold my hand. Now give me the gas. Where the gas at? Give me some stuff to put. Yeah, and we'll talk to y'all later. Let's go. Give me the good stuff.